Sleep is one of the most important parts of our health, especially as we get older. It helps our body rest, recover, and repair. But what happens when your sleep is not as restful as it should be? What if you are sleeping 8 hours, but still feel tired when you wake up? What if your partner tells you that you stop breathing during the night? These could be signs of a condition called sleep apnea. Sleep apnea affects millions of older adults, and many do not even know they have it. It is often missed or mistaken for normal aging, but if left untreated, it can lead to serious health problems. In today's video, we are going to talk about sleep apnea in seniors. We will explain what it is, what signs to watch for, and why it is so important to take it seriously. You will learn how sleep apnea can affect your heart, your memory, and even your mood. And most importantly, we will talk about what you can do to get help if you think you or a loved one might have it. So stay with us. This information could change your life or the life of someone you love. If you are watching this and care about your health or someone else's, please keep watching. And do not forget to follow or subscribe for more helpful health tips. Sleep apnea is a condition where your breathing stops and starts many times while you sleep. These pauses in breathing can last for a few seconds or even longer. They often happen without you knowing. When you stop breathing, your body wakes up for a brief moment to start breathing again. This can happen dozens or even hundreds of times a night. Even if you do not remember waking up, your sleep is being interrupted. This prevents you from getting the deep, restful sleep your body needs. There are different types of sleep apnea. The most common type is called obstructive sleep apnea. This happens when the muscles in your throat relax too much during sleep. When that happens, your airway becomes narrow or closes, and air cannot get through. Think of it like a garden hose. If you step on the hose, the water cannot get through. In the same way, when your airway is blocked, your breath cannot get through. Another type is called central sleep apnea. This is less common. It happens when your brain does not send the right signals to the muscles that control breathing. In this case, the airway is not blocked, but the body simply forgets to breathe. A third type is called complex sleep apnea. This is a mix of both obstructive and central types. No matter the type, the result is the same. Your body is not getting enough oxygen while you sleep, and that can have a big impact on your health. Snoring is one of the most common signs of sleep apnea, but not all snoring is dangerous. Snoring that is loud, happens most nights, and includes gasping or choking sounds is more concerning. So how do you know if your snoring is a sign of sleep apnea, or just normal aging? Many people think sleep apnea is just about snoring or feeling tired, but the truth is, sleep apnea is much more serious than that. When your body does not get enough oxygen during sleep, it puts stress on your organs. One of the first things affected is your heart. Sleep apnea increases your risk of high blood pressure. Every time your breathing stops, your body releases stress hormones. This makes your blood pressure rise again and again during the night. Over time, this can lead to permanent high blood pressure, also known as hypertension. Sleep apnea also raises your risk for heart attacks and strokes. Your heart works harder every night to keep up with the stress. If you already have heart problems, sleep apnea can make them worse. Even people without heart disease are at higher risk if sleep apnea is not treated. Another area affected is the brain. Without enough oxygen, your brain does not function at its best. This can cause memory problems, confusion, or difficulty concentrating. You might notice that you forget things more often, or feel foggy during the day. For seniors, this can sometimes look like dementia. But in some cases, treating sleep apnea can improve memory and thinking. Sleep apnea can also lead to diabetes, or make diabetes harder to control. When your body is under constant stress, it affects how insulin works. If you already have diabetes, sleep apnea can make your blood sugar levels go up and down more than usual. Another danger is daytime sleepiness. When you do not sleep well at night, you feel sleepy during the day. This can lead to falls, accidents while driving, or trouble staying alert. For older adults, a fall can be very serious. It can lead to broken bones or time in the hospital. Finally, sleep apnea can affect your mood. People with untreated sleep apnea often feel irritable, anxious, or even depressed. They may lose interest in activities or feel too tired to enjoy life. All of these risks make it clear why sleep apnea is not just a small issue. It is a serious health condition that needs attention. But the good news is, once it is diagnosed, it can be treated. And treating sleep apnea can improve your energy, your mood, and even your life expectancy. So how do you know if you or someone you love might have it? Let us look at the signs you should not ignore. Sleep apnea often goes undiagnosed because many of its signs happen during sleep. But there are clear warning signs you can watch for, both at night and during the day. The first and most common sign is loud snoring. Many people snore, but with sleep apnea the snoring is often very loud and happens every night. It may also come with gasping, choking, or snorting sounds as the person tries to breathe. These sounds are your body's way of waking itself up to get air. Another sign is pauses in breathing during sleep. This can be hard to notice unless someone else sees or hears it. If a loved one tells you that you stop breathing for a few seconds while sleeping, do not ignore it. This is one of the clearest signs of sleep apnea. Waking up gasping for air or feeling like you are choking is another warning. This happens when your airway has been blocked for several seconds. Your brain suddenly wakes you up so you can breathe again. You may not remember it the next morning, but it is a sign your sleep is being interrupted. Daytime tiredness is also a big red flag. If you feel sleepy even after a full night in bed, your sleep may not be restful. You might find yourself nodding off while watching TV, reading, or even talking. Some people fall asleep during meals or while driving, which can be dangerous. Sleep apnea also affects your thinking and memory. You may have trouble focusing, remembering names, or following conversations. This is not just aging. It could be your brain not getting the oxygen and rest it needs. Mood changes are another clue. People with sleep apnea often feel irritable, anxious, or depressed. You may lose patience more easily or feel down without a clear reason. Morning headaches are also common. They happen because of low oxygen levels during the night. If you often wake up with a dull or throbbing headache, this could be why. Dry mouth or a sore throat in the morning is another possible sign. When you breathe through your mouth during sleep, it can dry out your throat. Sleep apnea can also affect your blood pressure. If you have high blood pressure that is hard to control, especially at night or early in the morning, sleep apnea may be the cause. Some people wake up often to use the bathroom during the night. Frequent nighttime urination is common in people with sleep apnea. This can lead to poor sleep and more tiredness during the day. If you or someone close to you has more than one of these signs, it is time to take it seriously. You do not need to have all the symptoms to have sleep apnea. Even one or two of these signs could mean it is time to get checked. Next, we will talk about why seniors are more likely to develop sleep apnea and what makes it worse with age. As we get older, our bodies go through many changes. Some of these changes make sleep apnea more likely. One major reason is the loss of muscle tone. As we age, the muscles in our body become weaker, including the muscles in the throat. During sleep, these muscles relax even more. This can cause the airway to narrow or collapse, making it harder to breathe. Even people who never snored when they were younger can develop sleep apnea later in life. Another reason is weight gain. As we age, it becomes easier to gain weight and harder to lose it. Extra weight, especially around the neck and upper chest, puts pressure on the airway. This increases the chance of it becoming blocked during sleep. Even a small increase in weight can raise the risk. Changes in sleep patterns also play a role. Older adults often spend less time in deep sleep. They wake up more often during the night. This makes them more sensitive to any breathing problems, which further interrupts sleep. Medications can also increase the risk of sleep apnea. Some drugs that help with sleep, anxiety, or pain can relax the muscles too much. This includes sleeping pills, certain antidepressants, and painkillers. These medications can make it harder for the body to keep the airway open during sleep. Chronic health conditions are also common in older adults and can make sleep apnea worse. People with heart disease, stroke, diabetes, or lung conditions are at higher risk. If you already have one of these problems, sleep apnea can make it more difficult to manage. Menopause in women is another factor. Before menopause, women have lower rates of sleep apnea than men. But after menopause, the risk becomes almost the same. This is because hormone levels that help protect the airway start to drop. Another risk factor is family history. If your parents or siblings have sleep apnea, you are more likely to develop it too. Neck size can also matter. People with a larger neck, even if they are not overweight, have a higher risk. This is because there may be less room in the throat for air to pass through. Finally, aging itself is a risk factor. The brain may become slower at controlling breathing during sleep. This increases the chance of central sleep apnea, where the brain simply forgets to send the signal to breathe. All of these changes make seniors more vulnerable to sleep apnea. But the good news is, there are ways to treat it and feel better. Let us talk about what you can do next. The first and most important step is to pay attention to the signs. If you or someone you love has symptoms of sleep apnea, do not ignore them. Even if you think it is just snoring or tiredness, it is better to be safe. The next step is to talk to your doctor. Tell them about your sleep, your energy during the day, and any other symptoms. If someone has noticed that you stop breathing while sleeping, be sure to mention that too. Your doctor may refer you for a sleep study. This is a simple test that checks how you breathe while you sleep. It is often done at a sleep center, but now many people can do it at home. You wear a small device that records your breathing, heart rate, and oxygen levels. The results help your doctor see if you have sleep apnea and how severe it is. If you are diagnosed, there are several ways to treat it. The most common and effective treatment is called a CPAP machine. CPAP stands for Continuous Positive Airway Pressure. It is a small machine that gently blows air into a mask you wear while sleeping. This keeps your airway open and helps you breathe normally all night. Some people feel nervous about using a CPAP machine at first. It may look strange or feel uncomfortable. But many people say that after a few nights they sleep better than they have in years. They wake up feeling more rested, alert, and happy, and over time the health benefits are huge. Better heart health, better memory, and more energy to enjoy life. There are other treatments too. Some people use a mouthpiece that moves the jaw slightly forward to keep the airway open. This is called an oral appliance and is fitted by a dentist. In some cases, if the sleep apnea is caused by a physical issue like large tonsils or a narrow airway, surgery may be an option. Besides medical treatments, there are simple lifestyle changes that can make a big difference. One of the most helpful things is to sleep on your side. When you sleep on your back, your tongue and soft tissues can fall back and block the airway. Sleeping on your side keeps the airway more open. You can use a special pillow or put a tennis ball in the back of your pajamas to stay on your side. Losing weight also helps. Even losing 5 to 10 pounds can reduce the severity of sleep apnea. Extra fat around the neck and chest makes it harder to breathe during sleep. Talk to your doctor or a dietitian about a healthy eating plan. Try to avoid alcohol before bed. Alcohol relaxes the muscles in your throat and can make sleep apnea worse. Even a small amount in the evening can cause more breathing problems at night. Avoid sleeping pills unless your doctor says they are safe. Many of them can relax the airway muscles too much. If you smoke, try to quit. Smoking causes swelling and irritation in the airway, making it narrower. This makes sleep apnea worse. Keep a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Good sleep habits support better sleep quality and can reduce symptoms. Keep your bedroom quiet and dark and avoid screens before bed. Light from phones or TVs can make it harder to fall asleep and stay asleep. All of these steps work together. Even small changes can make your sleep better and your days brighter. If you are not sure where to start, talk to your doctor. They can help guide you step by step. If someone you care about might have sleep apnea, your support can make a big difference. Many people do not know they have a problem until someone else notices. You may be the first person to see or hear the signs. Start by watching their sleep. Do they snore loudly almost every night? Do they stop breathing or gasp during sleep? Do they seem unusually tired during the day, even after a full night in bed? If you notice these signs, bring it up gently. Do not make fun of their snoring. Instead, show concern and care. Say something like, "I have noticed you seem very tired lately," or "I heard you stop breathing during the night and it worried me." Let them know sleep apnea is common, especially in older adults. Tell them it is not their fault and there are treatments that really help. Offer to go with them to the doctor if they are nervous. Many people feel embarrassed or afraid of the CPAP machine. They may think it is noisy or uncomfortable, but you can help them see the benefits. Show them videos or stories from others who use CPAP and sleep better. Encourage them to try it for a few nights. Offer practical help too. Help them set up the machine and clean the mask. Some people give up on CPAP just because they did not have help in the beginning. If your loved one uses a mouthpiece or another treatment, check in often. Ask how it feels and if they are sleeping better. Support and patience go a long way. Also, be understanding about their mood and energy. People with sleep apnea may feel grumpy, sad, or tired. It is not personal. It is the lack of rest and oxygen. If they are nervous about doing a sleep study, remind them it can be done at home. The test is simple and painless, and once they know what is going on, they can take steps to feel better. You can also help by making healthy changes together. Take walks, cook lighter meals, or avoid alcohol in the evening. These changes are easier and more fun when you do them as a team. Lastly, be patient. Adjusting to sleep apnea treatment takes time, but with support most people improve a lot. And when they start to sleep better, both of you will feel the difference. Sleep apnea is more than just snoring. It is a serious condition that affects your heart, your brain, and your quality of life. Many seniors live with sleep apnea and do not even know it. They think feeling tired or forgetful is just part of aging. But in many cases, it is not age, it is poor sleep. The signs are there: loud snoring, pauses in breathing, waking up tired, mood changes, memory problems, daytime sleepiness. If you notice these in yourself or someone you love, take action. Talk to a doctor. Ask about a sleep study. It could be the first step toward feeling better, thinking clearer, and living longer. Treatment works. CPAP machines help. Lifestyle changes help. And support from family makes a big difference. You deserve good sleep. You deserve to feel rested and well. Do not ignore the signs. Thank you for watching. If you found this helpful, share it with someone who needs to hear it, and follow for more health tips made simple and clear.